Contractor management, what a complex beast, eh? Because of its complexity, in the past we've viewed it as a burden. A burden because it is hard work, it can be challenging. Burden because sometimes we feel like others are trying to manage our risk for us, which is problematic. Now, to help put this presentation into perspective, we at Field & Hogan, like many others in the room, approach contractor management both upstream and downstream. So upstream because we've got client requirements and expectations filtering down which we need to fit within our own already established systems, and that's really challenging. On top of that, we're engaging subcontractors directly, and from time to time they're engaging subcontractors too, so subletting. So potentially we're in situations where we've got 4 levels of the contracting chain all working together trying to make the same systems fit on the same projects. So I agree, it is complex. But I guess the question that we need to ask ourselves, and we can continue asking ourselves this in the future, is are we doing contractor management well, or are we doing contractor management compliance? Because they're 2 totally different things. Now, when you hear contractor management or start talking about contractor management, what's the first thing that pops into your head? Because if you're like me, it's this guy, sitting behind a desk with piles of paperwork, sending contractors emails or contractors receiving system-generated emails saying their pre-qual or their insurances have expired. Or the good old days of us sending a contractor email and asking for a whole heap of evidence. Evidence that may be training records or training matrices, risk management documentation, or any other health and safety manuals that they might have. Which brings me to the next question. What have we done with the evidence in the past? Where does it go? Who manages and reviews that evidence? Because we know that if we request and hold information like that, we should probably do something with it, right? Now this approach, which I call contractor compliance, is it really making a difference? Is it adding value? Or are we simply ticking a box? Are we ticking a box, or are we 100% committed and serious about making and creating safer work environments for our people? Because that's what's important, and that's what good contract management is. Now, it is important to note, we can do both. We can have a good, robust system in place which does those checks and balances, which verifies that our contractors or subcontractors are competent, but it needs to be while we're focusing on contractor engagement, high levels of contractor communication, and ensuring that we're listening, learning and sharing to lift industry standards together, because that's what's important. What we do know is if we treat contractor management like a tick box, we see results like this. And we've experienced that within businesses I've worked before. In fact, it was only 2 years ago where subcontractors were involved in 65% of our incident and injuries across my area of responsibility. So if you compare our subcontractors' hours worked versus our employee hours worked, that's really skewed. Subcontractors may equate to 25% of our hours worked. So is it really acceptable if someone completes 25% of our work, are involved in 65% of our events? Not at all. Not even close. We need to do more, and we need to do better. We know if our contractor management is poor, injury and incident rates increase, critical risks don't get managed well, and can we actually say we're putting people at the heart of our health and safety strategy? I don't think so. Which brings me to this. Early 2022, Waka Kotahi engaged with the industry and asked for feedback on what was then their draft expectations document. Initially we thought fantastic, an opportunity to work together and shape what good contractor management and engagement looks like. We raised concerns around the level of reporting that was required, which was going to cause duplication, especially for lower level events. We raised concerns that we could not share information that was under legal privilege, and we raised concerns that we could not allow another PCBU to change or modify our final investigations, although we appreciate there's an opportunity to have a really good discussion and ask questions following that final report. Now, that's all good contractor management and engagement, right? Unfortunately, the industry that provided feedback didn't get a response. So if we were being honest with ourselves, when requirements or expectations are implemented that we've given feedback on and we can't or haven't agreed to it, how do contractors navigate their way through that scenario? Well, let's talk about it. We may meet some of those requirements, but we haven't and can't meet all of them. Are we really advocating for honest and open reporting, which is questionable? We expose both lead PCBU and lead contractor because we're not doing what we say we're going to do. And that's really, really important. We need to say what we do and do what we say. We may become disengaged, and we know, like many others have discussed today, if PCBUs are trying to work together and we're not engaged or we're not aligned, it makes it really hard to achieve the outcomes that we want. And it could potentially shut down the opportunity for open comms and sharing, and that's what's important. But what if good contractor management consistently looked like this? Everyone has a seat and a voice at the table. Everyone has the opportunity to be involved in discussions and decisions which may affect them or their people. What about we increase our face-to-face engagements that we have? Whether that's breakfast presentations like this, joint site visits to verify critical risks are being managed well, or even face-to-face interactions when we're engaging new contractor management. That again is what's important, because what I love about health and safety, and a lot of other people do, is when we have that open relationship, we create the platform where we can put stuff on the table. We may not agree on everything, we may not always be aligned, but we've got the relationship that that's okay. And we can discuss it, and we can work through it to find solutions or meet in the middle. And having the discussion is what's important. To give you a little bit of scale, across Field and Hogan we've currently got well over 2,500 contractors approved today, which could potentially be working. So we're not saying it's going to be easy, we're not saying we're always going to get it right, and I'm sure NZTA and other people in the room have similar contractors as well. But the important thing is we're focusing on it, we're prioritising it, and we need to ensure that we've got the skill set and the resources to manage contractor management well. We know the impact of positive contractor engagement and communication and collaboration does decrease our injury and incident rates. We know critical risks are going to get managed well, and we know that by doing that we're putting people at the centre of our decisions. We know our sites will be safer, and the important thing is we create the platform and trust where we start managing risk how we want to manage it tomorrow, not how we managed it yesterday or in the past. We need to be moving on the journey forward. Which brings me back to this. The recent discussions we've had with Waka Kotahi about their new draft contract expectations. We felt like we've had a voice and a seat at the table well being listened to. We've had some really good open comms back and forth where we haven't always been aligned, but we've tabled them, we've discussed them, and we've worked through it. That's what's important. We've seen a real positive shift in focus areas which is aligned with the industry. So a focus on how we're going to manage our most critical risks, a focus on how we're going to report and investigate our most serious events, and a focus on ensuring that we've got a really strong framework in place to manage the mental health and wellbeing of our people, which is really, really important. There's also been some good work done in ensuring that they're defining roles, responsibility, and overlapping duties. Now that's still an area we've got quite a bit of work to do as an industry, but it's fantastic to see that Waka Kotahi are taking on this journey as well. And then just touching on what Sue and Fiona have talked about today, really understanding our people, our site, who has the most influence and control. Just to close out today and loop back into a few key points from me, contractor management is two-way traffic. Good contractor management isn't just compliance. We need to be very clear about that. And manage risk, whether it's critical risks or contractors, how we want to manage it tomorrow, not how we managed it yesterday. And against the grain isn't always bad. We need to be open-minded to how others want to manage risk as well, because managing risk differently, like we want to tomorrow, is key. And challenge ourselves. Are we doing contractor management well, or are we doing contractor management compliance? Two very different things. And let's be very clear, whether you're the lead PCBU, a lead contractor, or a contractor, your decisions affect so many people throughout the entire contracting chain. So please ensure when we make those decisions, we're making them with people at the heart of them, and we're putting people at the centre of our health and safety strategy. Whether they're your people, our people, or their people, everyone throughout that process is important.